Oxcarbazepine is a medication that is used on its own or in combination with other medications to help manage seizure disorders, such as epilepsy. It helps to control and prevent seizures from occurring. It is important to take this medication exactly as prescribed by your doctor, usually 1 to 2 times a day, with or without food. It is best to take it at the same time each day to help maintain a consistent level of the drug in your body. Before you start using oxcarbazepine, make sure to read the medication guide and instructions for use provided by your pharmacist. Ask your doctor or pharmacist if you have any questions. Shake the bottle well before each dose and carefully measure the dose using the oral measuring syringe provided. Do not use a household spoon because you may not get the correct dose. You can swallow the medication directly from the oral syringe or mix it in a small glass of water. Take this medication by mouth with or without food as directed by your doctor, usually twice daily. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Children's dosage is also based on weight. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce the risk of side effects. Be sure to tell your doctor and pharmacist about all the products you use. Use this medication regularly to get the most benefit from it. Take it at the same times each day to help you remember. Do not stop taking this medication without consulting your doctor, as some conditions may become worse if the drug is suddenly stopped. Your dose may need to be gradually decreased. Tell your doctor if your seizures worsen. Some common side effects of oxcarbazepine include dizziness, drowsiness, tiredness, nausea/vomiting, stomach/abdominal pain, headache, trouble sleeping, or constipation. However, many people using this medication do not have serious side effects. A small number of people who take anticonvulsants for any condition may experience depression, suicidal thoughts/attempts, or other mental/mood problems. Tell your doctor right away if you or your family/caregiver notice any unusual/sudden changes in your mood, thoughts, or behavior, including signs of depression, suicidal thoughts/attempts, thoughts about harming yourself. Tell your doctor right away if you have any serious side effects, including loss of coordination, vision changes, rapid/uncontrollable eye movements, shaking, tremor, easy bleeding/bruising, unusual tiredness. Get medical help right away if you have any very serious side effects, including signs of infection, symptoms of low sodium level. Oxcarbazepine may rarely cause very serious, possibly fatal, skin reactions. Some people in certain ethnic groups are at greater risk. If you develop symptoms of a serious skin reaction such as skin rash/blisters/peeling, itching, or swelling, seek medical help right away. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before taking oxcarbazepine, it's important to inform your doctor or pharmacist about any allergies you may have, especially to other anti-seizure medications or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. It's also crucial to share your medical history with your doctor or pharmacist, especially if you have kidney disease or a low level of sodium in your blood. This drug may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you can do so safely. Limiting alcoholic beverages is also recommended. If you are using marijuana, it's important to talk to your doctor about it. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant women, it's important to use this medication only when clearly needed, as it may harm an unborn baby. However, untreated seizures can also harm both the pregnant woman and the baby, so it's crucial to not stop taking this medication unless directed by your doctor. If you are planning on becoming pregnant or think you may be pregnant, it's important to discuss the benefits and risks of using this medication during pregnancy with your doctor. This medication can pass into breast milk but is unlikely to harm a nursing infant. It's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with oxcarbazepine. It can affect how other medications work in your body, which may lead to changes in their effectiveness. For example, it may interact with medications such as cabotegravir, cobicistat, elvitegravir, sofosbuvir, and rilpivirine. It's also important to note that oxcarbazepine may decrease the effectiveness of hormonal birth control, potentially leading to a risk of pregnancy. If you are taking other products that cause drowsiness, such as alcohol, marijuana, antihistamines, or opioid pain relievers, it's important to discuss this with your doctor or pharmacist. Additionally, it's crucial to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. It's also important to avoid using medications containing eslicarbazepine while taking oxcarbazepine. If someone has taken too much oxcarbazepine and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help. In the United States, you can call 911 or the local Poison Control Center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's crucial to act quickly in these situations. It is important not to share your oxcarbazepine medication with others. While taking this medication, it is important to have regular lab and/or medical tests, such as checking your sodium levels and complete blood count. It's important to keep all your medical and lab appointments and consult your doctor for more details. This medication has been prescribed for your current condition, and it should not be used for other purposes. If you forget to take a dose of oxcarbazepine, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at the regular time. Don't take a double dose to make up for the missed one. When storing oxcarbazepine, make sure to keep it at room temperature in its original container, away from light and moisture. It's important to store it in a place that's out of reach of children and pets. If you have any unused medication after 7 weeks, make sure to discard it properly. Do not flush oxcarbazepine down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company on the best way to discard the medication when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.